Okay, hello, good morning, kids, and good morning, everyone. My name is Mei Yi, and I have here with me Mr. Shahril Zaini.
Hi everyone.
Hello. Okay, kids, I am so happy to see you guys, and thank you for joining us on a Saturday morning. How is your Saturday morning? I'm so happy to see so many of you already on the chat and saying hi and all of that. So I will be putting on some of your comments or questions. If you have anything you don't understand later, you say, "Oh, Counselor Shahril, you talk too fast," or something like that. You can always just put in the comment, okay? And if anything you don't understand, you can always just put it on the chat as well. So my name is Mei Yi, and I am from Weekend Academy. And Weekend Academy runs classes for children like you when we can meet in person, in classes, in school. We do activities together and we learn about different jobs that is out there. So today we are going to learn about Counselor Shahril's job and we have bring in other different people with different jobs as well, people who are like lawyers or engineers or journalists, and they all come in to teach you about their job. So this is what Weekend Academy does. Of course, right now we can't go to school, kan? So all of you could not go to school. I know that you have had to stay at home. So we do this online session called Work in Progress. And currently we are doing the mental health series. So the mental health series will be in two parts. So today is Counselor Shahril. He's going to share with you. And then we'll have a second part next week, Saturday, same time, where we have Sibella, who is going to talk about how you can take care of yourself also and your family members, and what do you do when you burn out and so on. So two parts, okay? So do join us for both parts. And we have also a lot of other series before this about vaccine. Have you thought about how the vaccine come to Malaysia? And also about climate change. And we will share some of this link on the chat later on, so that if you are interested to check it out, do go to the link that I'm going to share, okay? But today I am excited because Counselor Shahril is here and he's going to share with you his work. And we know that we are in a pandemic, COVID-19, and a lot of doctors are working really hard. So Counselor Shahril is going to share with you how he works with the doctors and the nurses, people who are taking care of us. Okay, so if you have any questions, just put it there on the link. I see so many of you. Hi. I'm good. Thank you for asking. I hope you're good too. And I'm gonna put in the future, if you ask a question and all that, I'm gonna put it on the screen like this. So, for example, I just put this link, so it will show up on the screen. So, if you have questions, you just type it onto the chat straight away. Later on, when we have Q&A, when you can ask Counselor Shahril any question, I will put your question onto the screen. Okay, so don't feel shy. Just go ahead and straight away ask your question on the chat. All right. Is everyone ready? I am ready and I'm very excited. So I'm going to put this onto the screen. Okay, this is Counselor Shahril's presentation. And I'm going to leave the screen, but I'm going to be in the back seat. All right. So, Shahril, take it away.
Alright, thank you Mei. Hello everyone. So my name is Shahril and I'm a counselor. So today's topic will be talking about mental health in public health clinics during the COVID-19 pandemic. With me, Counselor Shahril. You guys can call me Shahril or can call me Uncle, whatever suits you best. And so we go on. My name is Shahril. KVPA is means that Counselor berlesen dan perakuan amalan, meaning that I'm registered and I'm a pegawai psychology counselling working in Pejabat Kesihatan Daerah Muar. Okay, so I'm going to explain about that more in detail later. But for now, I'm going to tell you about the outline of today's topic. Okay. So first we're going to learn about the first topic we're going about mental health challenges for frontliners. Frontliners including doctors and nurses and also all the medical assistant and all the other stuff there. So I'm going to tell you about what they usually do, and then what they have to do during this crisis, and then what are the effects that they can have to their mental health. And then what do I do to support them? Okay, that is the first part. And then for the second part, I will tell more about my current job and my we go specifically focus into my field, which is counselling. So I'm going to tell you about what happens in counselling session. How do we know if we need counselling? And how to get counselling services from public health clinic. Okay. So the third part will be mental health industry. So how do I become a counsellor? I'm going to tell you more about my life journey, and I'm also going to tell you about the other roles in the industry and the differences. Okay. I saw a question about how old I am. That's why I'm a bit amused. I'm 31 years old this year. Okay, so Pejabat Kesihatan Daerah Muar basically is the HQ, the headquarters for all the clinics kesihatan. For example, in your district, maybe you have like 11 to 12 clinics, right? In Muar, we have 11 health clinics under Pejabat Kesihatan Daerah Muar. And all the nurses and the doctors, the ambulance and the driver is all managed by the Pejabat Kesihatan Daerah Muar. You can see in clinics, you can see doctors and you can see nurses, right? But when you go to the clinics, can you actually see a counsellor? I don't think so, right? Many of you just come and see the doctors and then the nurses, and all of them just give you the treatment, and then you never really see counsellors, right? So for a Counselor is a professional helper, and we help clients get through their problem and issue based on psychological theories. This is what I do. And usually we get client only when the doctors say that, oh, this person may need some psychological help. And then they refer to me. And then I go see them. And what is psychology? Psychology is the thoughts, the behavior, emotions, and surrounding factors. So this is called psychology. All of this, how they interact together, is called the study of psychology. So for example, because of your surrounding factors, your culture, because you are being brought up this way, because your family is this way, then you may react this way in this situation. So as a counsellor, when people have this kind of problem, they come to see me, and then I help them to be better and go towards their goal. So what do counsellors do in health clinics? Okay, so patients referred by the doctor for various issues. Some come to me because of marital problem. They come to the doctor and they say like, oh, I have headaches. And then apparently they start to talk about their relationship with their husband or wife. So then the doctor say that, oh, headache because of stress, and then they say send to counsellor. Alright? And this is important to have counsellors in health clinic, because if they have stress for a long time, patient may have mental health disorder. Alright? Mental health disorder are the conditions where behavior, thoughts and emotions of an individual is altered for some time and causing disturbance in daily functioning. Meaning that they are stressed for a long time. So long time, for 2 or 3 months, they have problem with their relationship with their husband. And then suddenly they start to cannot sleep. They lost appetite. And then they cannot go to work anymore. So that is mental health disorder. So what counsellors do? We help them to resolve their problem before they get to this mental health disorder, which usually they have to go to the hospital and see pakar, right? So that's about me and what I do in health clinic. So frontliners, the nurses and doctors and medical assistant, etc. What they usually do in the clinics, if you come to the clinic, they give you diagnosis. They see if you get wound or something like that, right? If you injure yourself, they give you bandage. They will give you medicine. They give you Panadol for your fever. Okay, so that is what they do. The pharmacist also involved in giving medicine, etc. Right? And the other things that they do, they also do some health programs. So for example, maybe your parents or your grandparents who have diabetes, sometimes they go to the hospital and they do some sort of camp, like a workshop where they are taught on how to manage their problem better, their disease better. And also some of the health programs are like the program Ibu dan Anak, so like pregnant parents, pregnant patients come and learn about how to take care of their pregnancy better. Okay, and all the administration work, administration work is like registration, taking of the money, etc. So now we come to today, what they have to do during the COVID-19 crisis. If you can see the pictures, see this doctor are doing wearing PPE, right? So they have to wear all this PPE to avoid risk on their self, from infection on their self. So when they do this, they do the sampling, which is the poking the nose, right, to see if you got COVID or not. So that is one of their job. And then after they do that, also they need to key in the data. They need to see if your friend and your family who see you, they need to contact them as well. So all of this they need to do the COVID, and also they have to do the vaccination. I hope a lot of your parents and grandparents are already vaccinated and not scared of vaccination. And then they also do research and all this kind of things. And furthermore, during this time, they see more acute patients, which mean acute meaning that when they see the patients, it's already been at the worst stage. Sometimes they have to come to see the patient and then send them to the hospital. And sometimes maybe some complications can happen even before they arrive in the hospital. So that is different. Okay, so we continue with the next one. Okay, these are the pictures of the sampling team. If you can see, this is my colleagues in PPE. It's very hot in all this one. This is when the sampling, if you come to come to the sampling CAC, what we call it, at the camp, right? If when you get the call from the PKD and they tell you you are in contact with a positive COVID-19 patient, and then you have to come here and see them, and you see there's a lot of people actually queuing up in the rain, and they have to go through all this, have to poke the nose of all of these patient and see if it's positive or not. And also there's an ambulance like this who come and bring up the patient who don't have their own transport. You see, sometimes there are elderly or some people who are in contact with the patient, COVID positive patient, but they cannot come to the sampling place by themselves. So they have to send the ambulance, have to drive them to this place. Okay, so these are what happened in sampling team. So these are the vaccination team. If you can see here, they have to use they help with the registration as well with the MySejahtera app. So in Muar also they use the mobile vaccination unit, the COVID-19 bus. So they go to the halls of rural area. They go to the Dewan Balai Raya of the kampung-kampung, and then they do the registration at the Dewan, something like that, and then they come up into the bus and they get vaccination inside the bus. So all the procedure is actually happening inside the bus, but all the registration etc. will be outside. So that is a vaccination. Okay, so what are the effects for them during this COVID-19 crisis? Okay, so for example, they have their regular job, right? But then they added a lot more things that they need to do. So if you have to imagine, okay, you have regular ongoing classes, you have your homework, you have your class to attend, but then you also have an examination to answer. This is what COVID is. It's like an examination. So you have to prepare, you have to study, and then you have to do it and you have to focus, but at the same time you still have to do all the other chores. So imagine that. And also during this PKP, right, we cannot go hang out with friends, we are far from loved ones, and then we cannot engage our usual hobbies. For me, for example, I like to go karaoke, but now cannot go karaoke. How so it's added stress to all these colleagues of mine. Okay, so let me tell you a story about Dr. Hesh in one of the clinic kesihatan that I've been through. So she told me about her experience during the first lockdown, during the first COVID wave, right? COVID-19 wave. It was stressful for them to adjust to all of these extra tasks, and then all of this as well, the challenges we have during PKP. But then she got used to it, and her feelings got a little bit better. But then after a while, because her family and her children also are doing online learning like you guys are doing right now, right? So she have a few challenges about one of the children cost their bill to be around 1,000 or something more like that, and then she has to find some other way to cover the bill. So this may have been a problem for her lah, for that doctor. She have to cover a lot of costs about like children learning at home, helping them with homework as well, right? So it's a lot of stress for my colleagues. Okay, so how would you feel if this happened to you? Okay, this is happening to my colleagues in the hospitals and in the clinics. They are feeling stressed, they are feeling tired, and they having fatigue, which is tired but a more severe way. They feel stuck, like, oh, already 1 year, is anything happening or something? They feel angry. Oh, why is it still like this? Why the number still high? Okay, so that is angriness. And then they feel sad. Oh, I cannot help with my family anymore. I have spend less time. And then they feel hopeless also. It's been, when are these going to be over, right? Okay, so when these feelings continue for a long time without any help, without we helping them process this feeling or helping them vent out this feeling or somewhat reduce it, they may present with anxiety symptoms. Anxiety symptoms are called kerisauan atau kebimbangan in Malay. So they have shortness of breath. Is one of the anxiety symptoms. Shortness of breath meaning that you cannot breathe deeply that you usually do. So you suddenly like shortness of breath, and then you have increased heart rate. So you can feel like your heartbeat is very fast. You overthink. Sometimes you like think about that problem, or kerja rumah tak buat. So it goes over and over, and then macam cikgu akan ni something like that. So for that is overthinking. And then some people also have experienced panic attacks. Panic attacks meaning they have the shortness of breath and increased heart rate in a very severe manner, meaning that it's a lot worse, and sometimes it stop them from doing their own job or their activity at that time. So they go panic and they have to stop what they are doing at that time. And also they can have loss of sleep. Loss of sleep, okay, they already ready for bed that night, but they cannot fall asleep. So they can present with depression symptoms. This is a little bit different. So you can also have the like loss of interest. For example, maybe before this you like to play PUBG or Roblox, right? And you play these kind of things for fun with friends, but then suddenly you don't have interest in playing with them anymore. You play, but you feel like it's not fun anymore lah. So that is loss of interest. And then changes in appetite. Either you eat more or you eat less. And then changes in sleep pattern. Changes in sleep pattern can be you sleep more or you sleep less. Okay? And also you have the pervasive negative thoughts. Negative thought meaning that, oh, maybe I'm useless, or I cannot do anything anymore, or I'm I cannot do anything. Everyone hates me. No one's love me anymore, something like that. But as human, we do have this kind of thoughts sometimes, But when you have depression symptoms, it starts go on your mind for quite some times, and it takes a long time for you to um, handle or reduce this kind of thoughts. So that is pervasive negative thoughts. So this can lead to long-term mental health disorders. I told you guys about mental health disorders before, right? So long-term mental health disorders meaning that all they have been feeling all of this, and it's also start to disturb their relationship, their professional life, their work, and also their basic functioning. For example, they are eating, they don't eat so much, they lost weight already, and then they sleep too much and cannot go to work. So that is like long-term mental health disorders. So it's similar to on how untreated disease or wound can cause long-term conditions. For example, like if you have a wound, if you injure yourself, and then you don't go to the clinics, right? So you bleed, and then afterwards, what happened? Afterwards, you'll be fainting, and then you will like, because you don't have blood, you don't have energy anymore. So you have to go to the clinic and get a bandage on your wound, right? Similarly to fever, also you have high pressure, but you don't take Panadol, etc., and then suddenly you'll be fainting, or it will get worse later on. So what do I do to help them, to avoid them having this long-term mental health disorder? Okay, so we do psychological first aid program. What are first aid? Any one of you already seen like first aid kit before? You know, like I put in picture here, but usually our first aid box will be white in color, right? But this one is very fancy one, so it's red and blue lah. So what are usually in first aid box, first aid kit? So usually for the physical or normal wound or illnesses or injuries, in first aid kit we have bandages, we have alcohol, we have thermometer, and we have Panadol and paracetamol. So all of these are more helpful to you before you go to clinic, so you can bandage it yourself, or your parents or your friend can do it for your teacher can do it for you before go to the clinic. You have to go to the clinic also, kan? And then they can use the thermometer to check your fever is too high or not, or maybe you just can take one Panadol, and then maybe they can observe you for a longer time before you go to the clinic. So this is the first aid kit, the physical one. But for psychological first aid, what we do are activities. Mostly the activities are to increase awareness of emotions and body condition. You know, sometimes when you are doing an exam, or you are doing some chores, etc., right? Sometimes you have very high momentum. You studied so much, you didn't notice you get tired. You didn't notice you are angry or you sad, because you are too focused on doing what you are doing, because of your responsibility, etc., kan? So this is what the first that we do. So to make sure they pause and they see, oh, I've been tired, I've been studying too much, maybe I need a break. So this is one thing that we do. And secondly, we allow them to vent out their emotions. So this is called debriefing. And sometimes we ask them, okay, how are you feeling right now? How you been feeling for this 1 month? And we discuss it in the group. And this one, sometimes we, when you go and have a fight with your friend, for example, kan, you gaduh dengan your best friend, and then you don't want to see him anymore. But then when you go home, you tell your brother, you tell your sister, oh, I gaduh dengan dia, blah 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 blah. You tell them, kan? You tell them everything, and then tomorrow you see that friend again. Oh, I think I okay. I think I am not angry anymore. So that is the venting out of emotion. When we talk to someone about our emotion, and then we feel a bit better about it. And also when we vent out in a group, they can see that a lot of them are experiencing the same feeling as well. So they don't feel alone. They feel supported. They feel encouraged, and they feel like, oh, they are not alone in this. There are other people who are experiencing the same thing. So that important as well of venting out emotions. Okay. So the other thing that we do is teaching and doing healthy coping skills. This, I think, you will be learning more and you'll be taught more by the next speaker in the series 2. Hopefully you come to that session as well, and hopefully you learn a lot more about coping skill. So I teach my colleagues about this healthy coping skills, including simple exercises like stretching, like writing a journal maybe. There are a lot of healthy coping skills that they can do, and also we remind them that they have support system that they already have, maybe talking to their family or talking to their best friend. Sometimes when people are too busy, they forget about those kind of things. They forget about, oh, actually I can talk to my parents about this. Actually, I can talk to my family about this. So we remind them during this program. And the most important thing, we screen for those who may need more help. This is like the thermometer one. So sometimes we do all of this program, and we can see a few people that are still, may need more help. I mean, some people who are like, we can see that we exercise, we do fun activity, but also the face is like very sad and like not fun. And when people say, people share about their emotion, etc., they start to have tearing up. They start to disengage. So those kind of people may need more help. So those one we will be referred to personal counseling session if needed. So those one I would take note about them, and we will offer them to come to see us one by one. Alright. So that are what I do. And this program is not only just me. I also work together with my team, which is including doctors, and also physiotherapists, and all of that. Physiotherapists are the person who helps you with physical rehabilitation. So, for example, if you have injury in your arm or in your leg, and then you didn't walk for like a few months, then you need more help to recover your I cannot say walking. Recover your walking gait, etc. Right? So the physiotherapist is more about your physical one. So they usually do the exercises, right? So that is physiotherapy, and there's a lot of other people in our team, and they all have the psychological first aid training lah. Okay, so continue on. Okay, this is the pictures of the program. You can see here the stretching done by my friend, my colleague, the physiotherapist. So here we are talking about what they are doing, how they are doing, and then also giving some tips and tricks. Here we are sharing, we are writing about their feeling, about how they are doing, and those kind of stuff which help inventing, and also allows them to learn on how to write or journaling in helping themselves. Okay, so these are some of my teams also there, you can see there. Okay, so I'm going to tell you a story about this other doctor who, during one of the sharing session, right, they tell us about their feeling. Okay, one of the activity I do is a timeline activity, in which I ask clients, or in this case my colleagues, to put a line graph, in which in the x-axis, the horizontal line, we put the dates. For example, like, because the COVID situation started from March last year, right? So I tweaked the activity and asked them to do March 2020, April, May, June. So it starts from every month. So I asked them to do those line, and then for the vertical line, I asked them to do put in your emotions or your feelings or conditions in the scale from 1 to 10. Okay, so 1 to 10 during the March is quite low, because it started already PKP and all of those COVID-19 work, right? So it's very low. And then April also is going down. And then at that time we did the first series of our PFA, our psychological first aid program. And then this doctor shared that, suddenly her emotion at that time on April or May gets a little bit higher, gets to around 6 or 7, which means a little bit more positive compared to last time, because they feel supported. They feel, there are someone else who are taking care of us as well. We're not doing this just for ourselves. We're not doing this alone. Other people are going through this as well, and there are people who are willing to support us, and we can give us more help if needed. So they feel like that, and then it goes to 7 or 8 when we do the activities. So that is one I want to share. And and then of course it goes down a bit when they don't see us, and then during Hari Raya also it goes a little bit down because they cannot go back home to see their families. But we try our best by doing these activities, and I think we're still going to do this activity in the next month. I think we're going to see them again. Alright, so we finished with the first part, which is the mental health challenges for frontliners, doctors and nurses, and what I do to support them. So I talked about what they usually do, what they have to do during COVID-19 crisis, the effects, and what I do to support them. So before we go on the next topic, which we focus on our part, do anyone have a question? Or should we go, or is it free of charge? The services in the health clinics all are not free of charge, but you have to pay. If you are a Malaysian citizen, you have to pay RM1 for registration. But if you're, for example, you have I'm not sure if it's for children, is it free? But if you are if your parents are working under government, right, and then you can produce that letter, then it will be free. But mostly if you have to see me or see the doctors as well, if you are warga negara, the most you have to pay is RM5. But mostly RM1. RM5 if you have to see the pakar. So it's mostly free. Teacher, I always boring and stressed because I can't understand what I learn. That one, I think you maybe need some help to see. Maybe see your counselors and ask them about learning skills. How you can learn better. Sometimes we have what you say. Everyone in the class have different abilities and capabilities, right? And sometimes maybe your friends are better than you and go faster than you, and then sometimes you cannot catch up with them. So you better try to PM your teachers lah, because now we don't see them kan. PM your teachers and ask them on how I can do this better. How can I catch up with my classmates? Because for sure your teachers all would be very glad that you come and reach out, because now online learning also, right, they cannot see you and see you doing the work by themselves, right, by yourself, and then see how your progress is. So it's good to have communication with your teacher and ask, oh teacher, I cannot catch up with this, can you help me? Usually they will be very helpful to help. But then you also have to talk about the stress with your parents and family and try to plan it out. But if it doesn't help, try to talk to your school counselor as well. Sometimes it will teach you on how to focus and how to handle that stress better, right? So are you scared? Is it question for me or is it like a conversation? But okay, I answer first lah. At first, most of the frontliners, most of the doctors and nurses are quite scared as well for the COVID-19 crisis, especially during March last year, right? Many feel like have the anxiety, the kerisauan thingy. in them. For me, not so much. Uh, Not as much as others who have to face the positive patient face to face, but at that time there are little understanding about COVID-19. But currently we know if we follow the SOP, we follow the penjarakan social distancing, 1 meter from each other, we wear masks, we wear PPE, everything, we reduce the risk of infections a lot. And so currently there's not a lot of anxiety for the frontliners because we already understood it. But during March, we are worried about, if I go back home to my family, they get infected, and then we every time we go back from the clinic, we wash ourselves very thoroughly, etc. And sometimes do it like 2-3 times. But now we kind of understood. As long as we do our best in social distancing, sanitize our hand, wear our mask, and then it's not something to be worried about. Alright? How to know we are stressed? Okay, there are actually a lot of resources online as well. You can answer it, but there are a few signs that you can see lah. For example, you feel tired easily, you cannot focus, or you think about that situation or that problem too much, and then that is what called stress. And you can find a link. I think Hospital Sungai Buloh have already put a link about how to do the DAS score, DAS question online, which is depression, anxiety, and stress scale online. But that is a question which is a lot about the counselling, and I will go into the how do we know if we need counselling. So I will go on about my topic now, focus, if it's okay, right? So part 2, counselling. Let's recall about the few words and words that we go through before lah. So counsellor, I am a counsellor. I saw a question if I'm a doctor. What? No, I'm a counsellor. Counsellor is a professional helper, helps client get through their problems, issue based on psychological theories. Okay, so that is a counsellor. And psychological theories. What is psychology? Psychology are the study of thoughts, behavior, emotions, and surrounding factors. So basically on how all of these work together and interact. For example, like, you are being brought by your family like this, like this, and then your thoughts will be like this, and then in these circumstances you will feel like this. This is the psychology. And then what do counsellors do in health clinics? What I do in clinics, I see patients who are referred by doctors for various issues like stress or development. Maybe your brother or sister, your younger sister or brother, they have difficulty talking, even like after 5 years or 4 years, right? They talk just like a few words. Then they may send, the doctor may send to see us as well, counsellors. And then it's important because prolonged stress can cause mental health disorder. So this mental health disorder, I told you before, when the behavior, thoughts, and emotions is altered and it's already disturbed your daily functioning. So your basic needs, your eating, your work, and then your relationship, that is all affected. It's called mental health disorder. Alright. So what happens in a counselling session? Okay, this going to be a bit complicated and a bit long. So let me take a few sips of my drink first. Okay, firstly, my example is Sarah feels that she cannot fall asleep easily at night, and that makes her tired all day. So she feels tired all day, she cannot sleep at night, and then she goes to the clinic and see the doctor, right? And then doctor say, okay, she needs to have some changes in her behavior, which is sleeping. So they send to see me, and I go to see counselling. The first one we do is establishing therapeutic relationship. So therapeutic, it means healing relationship. So when you see someone, some people, maybe your a friend or your classmate, some people you may have a difficult relationship with, or maybe you got like friend with them, but then when you see them you get annoyed or you get angry, like that kan. So for relationship with us, counselor and the client, we need to have the therapeutic or healing relationship, meaning that when you are in contact with us, you would feel healed or feel better, feel comfortable. So like another therapeutic things are like massages, therapeutic massage. You go to the massage, people massage you, and then you go out feeling better, right? So that is a relationship that we have with the clients. So when you come to see me for 1 or 2 hours and you go out, you will feel better. So that is the first one that we do. And the second one, we do like a detective. We explore and we assess the issue. So I will ask a lot of questions to the client, like to Sarah. Sarah, so you cannot sleep. You only sleep 1 to 2 hours at night. What do you do before you sleep? And then she would say her answer everything, and maybe she played games, she played Roblox, etc. Okay, so maybe I'm going to ask also how is her circumstances in her bedroom, how many people in her room, etc. Because all of this might affect her sleeping pattern, which is the problem, right? And then we also set up therapeutic goals. Therapeutic again is healing, so it is related to the problem that she's having. So maybe she sleeps from 1 to 2 hours per day, and our goals can be like we're going to make them sleep 4 to 6 hours per day. All right, the healthier one. So collaboratively means that it must be agreed by the clients as well. Okay. So collaboratively, if the client say that, oh, I cannot I don't think I can do that, and then we try to set another goals and that big goal is about increasing the sleeping hours, right? But then we usually have the smaller goals to achieve that goals for example, to help Sarah sleep better at night, maybe we could lessen the time she play game like Roblox or PUBG, maybe from 2 hours per night until to 1 hour. So that is smaller goals that we collectively together, I and Sarah, agree on. Alright, and then we go to interventions to change. What intervention is? Intervention is the action or process to stop or modify existing situation. For example, if you see a trolley rolling down a hill, right? You come and stop the trolley, so that to avoid collision or to avoid berlanggar at bawah kan. So that is what intervention means. So in this case, in Sarah case, she cannot fall asleep, and so the interventions that we do that are based on the assessment of the issue and what the problem that she have is, I ask her to exercise so that at night she would feel a little more tired and more ready to sleep. And also we discussed maybe she should lessen her time with the phone. Problem with the phone, if you like the blue light from the phone can cause your sleeping cycle to problem as well. So lessen the TikTok and all of those kind of thing and then 5, we do the progress check and further intervention. So we check, did you stop using your phone too much at night? And then okay, and then your sleep improve or not? If it's not improved, then we do further interventions she didn't play phone but still cannot sleep, so maybe we change it to we do something more. We see if something else is disturbing her. Maybe she's actually thinking too much before she sleeps. Now that she doesn't play phone, she start to think about her previous problem, etc. Right? So we do other interventions. Maybe we talk about the problems, allow her to vent out about that problem, and then we do another progress check next time and see if it works. And then if it's already worked, and then she say like, oh okay, Cik Shahril, I don't think that I I need to see you anymore lah. I think I already can sleep 4 to 6 hours already, and I don't need to see you to continue sleeping well. So, and then I also would say like, oh, I'm glad you're okay now. I'm glad you're having progress. I can see that you are able to be independent and you will be able to do all of this by yourself. We're going to terminate the session, okay? And so bye bye. But I also allows them to come to see me again if she have any problem in the future lah. But for the session itself, it's going to be terminated, right? So that is the process during counselling. So, cikgu you like, teacher you like, Cik Shahril uncle you like I know my friend went to counselling session but they all just talk and play je. Mana ada all that process kan? Do the checklist, the progress one, process tipu lah. Okay. So different counsellors actually have different style and psychological theories that they follow and different interventions that they like to employ. Meaning that based on their psychological theories, maybe they say that the problem is a bit different. Maybe for me, I say that Sarah cannot sleep because her behavior of doing activities before her sleep is the root cause. And then maybe Sarah goes to another counsellor, and another counsellor would say that both in the psychological theories, I think like she is having problem in the morning with her parents, and then she have some images and memories about her bedroom that makes her having problem sleeping. So that kind of stuff could happen lah, based on different psychological theories. And then intervention is also quite different. Some people may do play therapy. You can see puppets there. You can see fan there. You can see here drama. You can see some people use role play. I use role play a lot too. Role play, for example, like maybe you have a problem with your parents or something like that kan. Then we would role play. I would take a role as your father. Like, Achan, why you play games so much? No one to study. And then I ask you how you respond to that question. And then maybe if you say like, mana ada, I buat kerja lah, and then like that kan. And then your oppa will get a little bit more angry. And then I will like, oh yeah, you buat kerja blah 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 blah, something like that kan. A little bit more angry. And then we ask, how could you react to that question better? So we do those kind of role play. We do exercises and see that maybe if you react better to your father will react better to you as well. Okay, so that is like drama. I want to tell you a story about one of my friend also, Teacher Chan. Teacher Chan do play therapy a lot, and he deals with children most of younger than your age lah. So he used puppet and he called his puppet John. So one time there's a student come and see him because another teacher referred to him, right? And that children have some behavioral problem and focusing in class, but he doesn't want to collaborate with my friend. He comes to session and just keep quiet in the corner. What my friend do is like, hey John, this John is his puppet lah. So macam he tell John, hey John, see Abang doesn't want to talk to us lah. Yeah lah, why he don't want to talk to us? He afraid of me ke? Or maybe we should just sit with him and see how we doing lah. Something like that. He do that for 45 minutes during that session because that client, that kid don't want to talk to him and not open to him yet. So that is actually, if you see the process, is establishing therapeutic relationship. Because of the talking about my friend talk with John, in the next session, they actually the kid actually talk to John and talk to the teacher properly and like very open to him lah. Okay, so that is the story of him. There are a lot of story kind of like this also. Like you cannot see all the 6 steps, all the things that done in counselling, but they are actually like an intervention and have our own goal set. Sometimes we tell them, so sometimes we tell client that, oh, we're doing this because of this, but sometimes we just do that, and the client has to trust us about the process, and it will be helpful. Okay, so next slide would be about, and the most important thing is actually the relationship. You need to trust your counselor, and your counselor need to trust. Your counselor need to be helpful with you lah, collaborative. So that is the most important thing. If you don't trust your counselor, then usually it won't be that helpful. Okay. So go on. Okay. Some people ask us, how do we know we go to counselling, or when do we need to go to counselling? So it's the same thing. When you're feeling stressed, you're getting fatigue, you're getting hungry, hopeless, or sad, so you need to see a counsellor. So usually, if you come to the clinic and have this kind of symptom, the doctor will ask you to see the counsellor. But if you have the symptom also, oh wait, this is the side. Okay, how do we know if we need counselling? Sorry about that. So when you presented with anxiety and depressive symptoms, which I talked about earlier, the shortness of breath, increased heart rate, overthink, panic attacks, loss of sleep, then or depression symptom, loss of interest, changes in appetite, changes in sleep pattern, pervasive negative thoughts. These two, if you come to the clinic, the doctor will refer you to the counsellor lah. But other times that you can come to see, and then if I want to say about stress, right, a little bit more about stress. If you think a lot, and then if you have this kind of thing, when you started thinking, and then you maybe start to have headaches about the problem that you're facing, then probably you are stressed and you need to see someone about it as well lah. So other times that some people see counselling is about family or interpersonal problem. You break up with your girlfriend, and then you got heartbroken. You can come to see counsellor as well. You don't need to have all these symptoms before you come to see us. And then if you want behavioral change, okay, I want to study more, I want to be number one. What do I need to have that motivation? Right? It's like our friend just now asked how to have motivation, how not feel bored kan. Okay, you can come to counselling and ask us what tips or what we can do to help and how you can change. We can do that as well. And then if you confused about a decision, nak makan apa tengah hari kejap lagi, makan nasi ayam ke, nasi lemak ke, apa ke, so you can come to see us as well. Not because of the makan-makan lah, but then if you have a problem of like making decision even about a little thing, etc., right, it would take a lot of your time. It will cause a problem in the long term as well. So if you have a problem about making a decision, you can also come to see us so that we can help you to make a decision more swiftly. So if you want to increase confidence as well, you can come to see us. For example, if you feel like, oh, I tak lawa lah, I buruk lah, tak nak lagi sekolah, I tak handsome. So you can come to see us, and then we try to increase your confidence, and we can see how we can help you in that way, right? Okay, so how to get counselling from Klinik Kesihatan? First of all, you have to get a temu janji for the clinic because currently some clinics doesn't accept walk-in kan, but some clinics my in the clinics that I'm working with, they still accept if you come and walk in, but mostly now they need to have appointment. You have to interview, you have to scan the QR code or go to their website and make an appointment. So after you make an appointment or you go walk in for the clinic that allowed it, you go and see the doctors. See the doctors and told them about what problem that you have. Maybe you have you feel tired all the time, or you feel anxious, you feel risau, cemas, panic, those kind of thing, or you feel sad for all the time, etc. Tell the doctor all of that. Or maybe you say like, my mom keep fighting with my dad, etc. You can also tell the doctor that, and then the doctor will give you referral to see the counsellor. And then when usually when they give the referral, we get a date for appointment lah. Because for example, like me, right, I have 6 clinic which I go through. So some days I go to this clinic, some days I go to this clinic. So if you walk in, sometime I'm not available at that time. So the doctor will give that referral, and all the other staff will say that, oh, Encik Shahril will come to this clinic at this time, so you can come this time. Okay, so that is the process of getting a referral to the counsellor and getting appointment. And then after that, counselling session will happen during that day of the appointment. So what's the best thing to remember at this time? Everything you say is, everything we talk about is confidential, which is confidential is secret. For example, if you tell me something about a problem at home you have with your parents or your father or what, I won't tell them if it is not important lah. If there are a few conditions that counselor will tell you about. When we have to break confidentiality, we have to break a secret. But mostly whatever you tell us, I couple dengan ini. I won't tell your parents your couple. Okay. So, and lastly, you have to give your best lah. Try your best to collaborate with the counsellor if you have like the discussion, and then have like some activities to be done. Try your best in doing it. Alright? Okay, we continue on. Okay, we finished the second part and it's already like 4 minutes left. That is going to be difficult. So I'm not opening question for this time. I'm just going to finish the last part. Okay, so how do I become a counsellor? First, I finished school, SPM. Yay! I'm happy at that time. Okay, but then I go and study something I don't like. I go to get degree something I don't like, and then I'm like feel bad, it's go down, and then I quit studies. I quit study also like feel bad lah, kan? Other people are studying, other people are doing well, but I don't do anything, but so sad lah. But then I do some soul searching as well. I think like, oh, what do I like to do? Actually, I like to analyze people. I like to see how people are doing. I like to see how they relate with each other. Okay, so I say like, maybe I should go to psychology, which is the study of emotions, behavior, circumstances, and also thoughts. Okay, so but I go what related in psychology, which is directly related to working professional. So I studied counselling in MSU, Management and Science University, which is accredited. Our course, our studying is accredited by the Lembaga Concealment Malaysia, that is LKM. So there are training hours needed for us to study. During our study, we need to do these training hours. We need to see clients face to face for 100 hours, something like that, before we can graduate. So that is actually viewed, all our courses, our classes, everything are viewed by Lembaga Concealment Malaysia lah. They jaga us. They see if anything is different, anything is wrong. Then they tell my lecturer, oh, you cannot do this, you cannot do this, something like that. For example, right, if you go study driving, if you belajar driving, you can learn driving from your neighbor or your father or your neighbor itself, right? But if you don't go to the school who are accredited by JPJ, when you go to JPJ and you get a test, even though you dah power driving dah macam apa racer kan, they won't be able to give you the license. JPJ won't give you the license because you learn driving from your neighbor or your teacher. You don't go to the accredited driving school by the JPJ. So that is accredited university. So and then after I graduated, I go to interview with the Lembaga Concealment Malaysia. So I go to interview, I show them that, oh, I understand this theory, I know what to do with this. And then during my training, I see this kind of patient, this is what I'm going to give when this kind of patient come. Okay, so when I pass the interview, I get the license, and now I'm working as a registered counsellor in the clinic. Yay! That is a lot higher than when I finished school, right? Okay, so moving on. Okay, this is the other roles in this industry and the differences. Okay, so there are psychiatrists, There are clinical psychologists and there are counselors. The biggest difference are the similarities first lah. We all work at hospitals and we all do this talk therapy like counselling, like psychotherapy or tech therapy. We do close relationship with patient and we do intervention, those kind of thing. But psychiatrists are doctors. They can give medicine. Meanwhile, clinical psychologists, they are more of a scientist. They do a lot of tests, meaning that they would like ask you how you doing this week, what are you feeling from 5 to 10, etc. There's a lot of questioning and assessing. That is clinical psychologists, but they are more helpful in helping the severe cases lah. So for counsellor, we are handled by the Lembaga Counsellor Malaysia. This is the jata. And then we do talk therapy as well, and then we also help people in schools, we help people in offices or industry, and some of the counsellors are actually working in here like the mosque, like Jabatan Agama Islam. Some of church also have counsellors, some Buddhist society also have counsellors, so you can also see counsellors in that area lah. Some do deal with people with marriage problems, something like that. And all of us have different accreditation and governing body lah. For psychiatrists, doctor, they are handled by Malaysian Medical Council. For clinical psychologists, there's Malaysian Society of Clinical Psychologists. And for counsellors, there's Lembaga Counsellor. So that are the differences. And also for other roles in mental health, next week you'll be seeing Miss Saibel, right? So she would be industry lah. She working in industry. I'm not sure if it's counsellor or not, but in industry there are some people who are helpful in like doing activities and intervention and giving awareness and talks. So that mostly we call them psychologists lah. Okay, continue on. Okay, we finished all of it already. I already run a bit longer kan. Okay, so thank you everyone. I hope not everyone are like that cat, like very very confused one. I hope some are happy like the mole. Okay, so question, how to not be stressed? How not to be stressed? Okay, like I said before, there are a lot of coping skills that we can have as human. We already learn about how to learn to release our stress lah, and we can see that from like I said before, doctors, my colleagues also, they sometimes they talk to their family, and that also help them to release stress. Some of them go and play games, some of them go and jog. So if for me, so also like if I'm angry or something like that, sometimes I go and have some physical activities, and that helps with relieving stress as well. But I think those the coping skill will be talked to you more in the next session, in the next week by Miss Saibil, I think. Yeah, so you can keep that question about how do you handle stress, how to cope, and ask her next week. Any other questions?
Okay. Yeah, I think that this is such a great sharing. Thank you, Councillor Shahril, and thank you, kids, for all of the questions that you have there. On the chat, I put in a few links. One of the links is for next week's session, which is with Miss Sibella, Councillor Shahril talk about. So that link is the YouTube link that you can join for next week. And Sophia, thanks for sharing. You listen to music when you're feeling stressed. I think that's a very great way to cope. Yeah, I like to exercise when I'm feeling stressed. So I know that, and then there's another link there called Buddy Bear. So that is kind of like a phone number that you can dial if you're really feeling very stressed and you think that there is no one that you can talk to. Remember, just now Councillor Shahril said that when you vent, when you talk about it, it makes you feel better. So if you really need someone, that Buddy Bear phone number is meant for students and children like you. So if you need to, you can go there. Okay. So all the links are already put in the chat. Go and have a look at that. And I hope that you will get to join us next week because we have a lot of more topic on mental health coming up as well. And I was a little bit concerned because I saw some of you say that you don't understand anything. I don't know if you're just saying like you don't understand anything, but in any case, I will keep another session open after this. If you want to have any questions that you want to ask, again, it's in the Zoom link in the chat, so you can come on and join, which I will open after this session is over. Okay, and the final thing is, I know what some of you are asking about the sigil. I understand the school will be giving out the sigil to you, so don't worry about that. So just reach out to the school for your sigil. Okay, and with that, I just want to thank you so much to Councillor Shahril, who put in a lot of time to come up with very, very cute presentation to talk to you about the work that he is doing. So please do thank Councillor Shahril as well. And I thank all of you kids for joining us. I hope this is something that is useful. And I see so many of you putting in a lot of good comment about taking in deep breath, crying and falling asleep, taking a nap, taking a break. Yeah, all these are so necessary because I know that you have been at home for so long and you don't get to go out. And I know it's a very difficult time, but it's a difficult time for adults as well. Like even for me, I some of the things Councillor Shahril said, I can feel it, like my heartbeat goes up very fast and all that. So I hope you will all be taking good care of yourself. That is very important, and I hope that I'll get to see you again next week. Okay, all right, thank you so much everyone, and thank you Shahril as well.
All right, thank you, Maggie. Thank you, everyone, for your wonderful comments and your wonderful questions. I hope some actually took something from it lah. Not like, because sometimes I talk so fast kan. So macam sorry about that.
Yeah,
thank you, Maggie. Thank you, everyone.
Thank you everyone. Bye bye. Have a good weekend ahead. Bye bye.